5 Facts about Medicaid, who it's for. Medicaid, a program that affects over 85 million Americans, yet many people confuse it with Medicare. It was signed into law by President Lyndon B. Johnson on July 30, 1965, as part of his Great Society program, which aimed to eliminate poverty and racial injustice in America. Medicaid serves low-income individuals and families, including children, pregnant women, the elderly, and the disabled, and is a means-tested program. Eligibility depends on income and financial need. This legislation also established Medicare, but Medicaid was unique in giving states the option to participate. The compassion of our country must be measured by how we treat our most vulnerable. Lyndon B. Johnson. Medicaid is funded jointly by federal and state governments. The federal government matches state Medicaid spending using the Federal Medical Assistance Percentage, FMAP, which ranges from 50% to over 75%, depending on a state's per capita income. Example: Mississippi receives around 77% of its Medicaid funding from the federal government due to its lower income levels, while wealthier states receive closer to 50%. Some programs, like Medicaid expansion under the Affordable Care Act, receive even higher federal support, up to 90%. Medicaid is now the largest health insurance program in the U.S., covering over 85 million people, roughly 1 in 4 Americans. In fiscal year 2023, Medicaid spending reached about $805 billion, accounting for around 17% of total U.S. health expenditures. Enrollment surged during the COVID-19 pandemic due to job loss and enhanced federal protections. Many states paused disenrollment during the public health emergency, but redeterminations have since resumed. Children represent about 40% of enrollees, but the elderly and disabled account for a disproportionate share of total spending due to long-term care and complex medical needs. Going forward, Medicaid seeks to enhance behavioral health services, including substance abuse and mental health coverage. Improve equity, addressing racial and income-based disparities in access and outcomes. Regulate managed care organizations, MCOs, to improve transparency and outcomes. Streamline application processes through technology and outreach. In 2024, the administration proposed increased funding for Medicaid modernization and crackdowns on fraud in long-term care services, though some critics believe Republicans are seeking to cut Medicaid to offset the cost of tax cuts. Managing Medicaid is crucial to addressing systemic inequalities. If you liked this video, like and subscribe. Thanks for watching.